The announcement of a second Ebola victim in Nigeria is raising fears that the 7-month-long epidemic in 3 West African nations could spread in the continent's most populous nation.
There is a second case of Ebola virus disease, and why we're able to know is because government has put in place strategy to detect cases. This is coming from one of the cases under surveillance, and that's why we're able to pick it early enough.
The first victim collapsed on arrival in the city and was put in isolation at a hospital. Had he spent even a few hours outside the airport, he might have spread his illness to more people, many of them impossible to trace in Lagos with its endless sprawl of tin roof shacks and apartments. Nigeria has strengthened its disease surveillance system to prevent and control the spread of Ebola within its borders. Passengers traveling from some countries in West Africa have been put on red alert, and public health officials have been deployed at all points of entry across the country. The government has also taken its campaign against the disease to the churches. With a knack for drawing huge crowds, authorities also see them as conducive environments for the virus to spread. Some were warned not to hold so-called healing sessions that could attract Ebola patients from outside the country. Information about the virus has also been widely broadcast on radio and television stations, as well as social media.
We've opened accounts on Twitter, on Facebook. We have a website now devoted to for information on Ebola, www.ebolaalert.org. It's functional, and what is so good about it is that it's an interactive website.
Experts, however, say rituals and traditions on handling of the dead may prove to be an obstacle in stopping the spread of Ebola.
It has been really challenging for West African countries like Sierra Leone to convince people not to really take care of the body of their relatives. It has been very challenging. 60% of infections are due to body-to-body, humans-to-humans contamination.
The epidemic has already killed almost 900 people in Sierra Leone, Guinea, and Liberia. The World Health Organization says the outbreak is moving faster than efforts to control it, warning that with more infections comes a greater risk of the virus evolving into deadlier mutations. Mohamed Ado, Al Jazeera, Abuja, Nigeria.